Some people wake up and think the morning feels a little off without knowing why. Others check their blood pressure and suddenly feel that tiny rush of panic because the numbers look different from yesterday. And here's the part almost nobody talks about. The numbers we all grew up believing were normal might not actually be the numbers your body feels safe with anymore. Let me take you right into it. Doctors often notice that the first reading people take in the morning is higher than anything they see during the day. Some studies even suggest that this early spike can reveal more about your future heart health than any exam you've had in the last year. And the strange thing is, most people don't even feel it happening. They just think they slept badly or had a stressful dream. One of my patients joked that her heart wakes up before she does, and honestly, she wasn't wrong. What most people don't realize is that these early changes in blood pressure have quietly forced specialists to rethink the old guidelines. Those familiar numbers we memorized for years might not match what your arteries are actually experiencing. According to some doctors, the real danger starts earlier than we once believed, even when a reading still looks harmless on paper. Your body cares less about perfect textbook numbers and more about how quickly those numbers rise, especially in the first hour after waking up. There is something else too. Some experts say that your lifestyle from the night before plays a bigger role in your morning pressure than anything you do during the day. A salty dinner, a late argument, a few hours of scrolling, even one glass of wine can push your morning reading higher than you expect. Your arteries remember everything you did yesterday even when your mind has forgotten it. And for people over 55, these tiny changes can add up faster than they think. If you've ever felt your heart thump a little harder when you first stand up or sensed a sudden heat in your chest before your morning coffee, your body might already be reacting to this shift. It's better to pay attention to these quiet signals because they often show up long before symptoms do. You can even try sitting a minute longer before measuring your morning reading and see what happens. And don't worry if your numbers look different from your partner's. A colleague once told me that comparing blood pressure is like comparing shoe sizes. Interesting, but completely useless. This is where it all begins. The new numbers are not just lower or higher. They tell a very different story about how your heart is aging and how your arteries handle pressure with each passing year. When you look closely at these shifting numbers, something interesting shows up. Studies show that about half of adults over 60 get their highest reading within the first 2 hours of the morning, even if their blood pressure looks completely normal the rest of the day. It's almost like the body does a little jump start that your arteries aren't always ready for. And the strange part is that many people think this spike is harmless just because it doesn't come with pain or dizziness. Some experts say this jump is linked to how your nervous system wakes up before the rest of you. That sudden rise can make your arteries tighten a bit, kind of like cold air hitting your skin. If you move too fast right after getting out of bed, your body reacts with a stronger push. One of my patients learned this the hard way when he stood up too quickly, felt a drum in his ears, and blamed his pillow for it. It was definitely not the pillow. Small habits can make this spike worse. Eating late at night, not drinking enough water, sleeping poorly, or even watching a stressful TV show right before bed can make your morning numbers creep higher. Some experts point out that even looking at your phone the moment you open your eyes can cause your heart to pump a little faster. Your body interprets everything as activity, even if you're still half asleep. There are things you can try that make the mornings gentler. It might help to sit on the edge of your bed for a minute before standing. Your heart gets a moment to adjust, and you feel less pressure in the chest. You can try drinking a little water before checking your reading or taking a slow breath or two. One of my friends swears that her blood pressure drops just by pretending she's still on vacation for 5 seconds. Honestly, if it works, I'm not judging. It's better to avoid measuring your pressure right after rushing to the bathroom or climbing stairs. Your body reacts to activity immediately, and those numbers won't show your real baseline. Your body will thank you if you let it settle before checking anything. And if your numbers look higher than they used to, but still sit inside the safe range, don't ignore that shift. Some specialists believe these early changes can be more meaningful than the reading itself. The pattern tells a story long before symptoms ever do. Those little jumps in your numbers, the moments when your chest feels heavier than usual in the morning, or the days when your pulse seems stubborn for no reason, they're all signals, not warnings meant to scare you, but gentle taps on the shoulder saying something needs a bit more care. I've seen so many people feel confused or frustrated by these shifts, but once they slow down enough to notice the pattern, everything starts making more sense. When your pressure rises, your body is not failing you. It is trying to protect you. Every vessel, every heartbeat, every adjustment is a sign that your system is doing its best with what it has. And the beautiful part is that small changes give your body so much relief. One patient told me he simply stopped rushing in the morning and suddenly felt like his heart stopped yelling at him. I told him that's the healthiest relationship improvement I'd heard that week. You can make your mornings calmer just by giving yourself a quiet minute before reaching for your phone or coffee. Let your breathing settle, feel your feet on the floor, let your thoughts catch up with your body. It may help to take a slow inhale through your nose before you stand, especially if your mornings tend to feel tense. Some experts say these tiny resets help your arteries relax before the day begins, almost like smoothing the edges of a rough start. Your pressure responds to everything you do, your sleep, your emotions, your habits, the way you move through your day. So treat each morning like a fresh beginning rather than another problem to solve. There's a good chance that listening to these signals early can save you years of struggle later. Your heart is on your side even when it feels unpredictable. And yes, it might grumble now and then, but honestly, who doesn't before breakfast? What matters most is that you stay aware without becoming afraid. Pay attention without becoming obsessed. Care for your body the way you would care for someone you love. The small choices you make today can protect your heart, your pressure, and your future more than you realize. If you found this helpful, subscribe and stay with me for more honest health talk.